Good afternoon. Thank you for joining the HHS Acquisition Regulation Proposed Rule Information Session. Today's session is being recorded. Closed captioning is available by clicking the CC icon at the bottom of your screen. If you need technical assistance, please click the chat icon at the bottom of your screen, type your question into the chat, and one of our techs will respond to you. I will now turn it over to Mickey Tripathi.
Great. Thanks so much, Cannon, and welcome everyone. Thank you for joining today, and thank you for your interest in the HHS Health IT Alignment Policy. I'm Mickey Tripathi, Assistant Secretary for Technology Policy, and let me just kick off with a few comments, and then I'll turn it over to the team for the detailed presentation. HHS spending on health IT-related activities has grown dramatically in recent years. The recent public health emergencies have demonstrated the importance of interoperable data to improve the quality, safety, affordability, and efficiency of healthcare delivery, and to inform pandemic response and identify and address disparities in care. In July 2022, Secretary Becerra signed a department policy directing ONC to establish and oversee the promotion of greater alignment of health IT-related activities across all relevant funding and policies across the U.S. Department of Health and Human Services. That policy, that's called the Health IT Alignment Policy, directs all HHS operating and staff divisions to include standard health IT language in applicable contracts, cooperative agreements, and contracts to ensure alignment of health IT investments. The policy also applies to applicable guidance and rulemaking related to health IT investments. The Health IT Alignment Policy is critical to ensure a consistent HHS-wide approach to standard health IT requirements across HHS agencies to make sure that we're using the best use of taxpayer dollars in all of our activities, and to be a good partner to industry as we think about all of the various ways in which the Department of Health and Human Services touches industry, whether it's through research or through regulatory activities related to safety or public health or healthcare delivery. In all those ways, we're touching different parts of the department or touching different parts of the industry. And we want to make sure that we're all doing it in as consistent a manner as possible so that industry has the best opportunity to be as efficient as they can in interacting with us. Awareness of health IT activities across the department is critical for HHS leadership decision-making as well, which is also an important aspect of this policy. The policy applies to all new HHS funding notices and announcements that include activities involving the adoption or use of health information technology standards and systems, or the interoperability of health IT, even if your agency does not use these systems directly. The HHS does not impose any new obligation to add requirements to use technology as part of an award. So, for example, it doesn't require that everyone use certified electronic health record technology or certified health IT any more than existing programs would. Recipients using funds should utilize health IT that meets nationally recognized standards where available. All funding requirements will be laid out in the notice of funding and solicitations to which you're applying, or in the requirements of receiving that funding. The policy intends to ensure that all recipients of funding from HHS who use health IT are also using HHS adopted standards, or at a minimum, vocabulary consensus standards. The policy applies to any HHS award, no matter the size, that includes provisions requiring recipients to implement, acquire, or upgrade health IT. Complying with this policy certainly does not prohibit agencies from including provisions in awards to address varying economic circumstances among recipients. So how does this benefit programs? Health IT standards are agreed upon methods for connecting systems together. The standards may pertain to security, data transport, data format or structure, or the meanings of codes or terms. The standards are defined, updated, and maintained by standards development organizations through a collaborative process involving the audience that will be using the standards. That's a very important point. These are consensus standards from industry that we adopt in ONC regulations and ONC approved standards, and work very closely with industry to make sure that these are standards that have applicability and feasibility in the market, and that are important for all of us to be able to get to the kind of ecosystem, interoperable ecosystem that has as much friction-free authorized exchange of information as we possibly can. There are many benefits to incorporating relevant health IT standards as appropriate and feasible into a program, such as for supporting grantee reporting and advancing the interoperable use of data. Relevant health IT data standards may include ONC adopted standards, as well as standards found within the Interoperability Standards Advisory. For example, for areas where there may not be ONC adopted standards, the policy basically says at that point, strong encouragement to use standards that may not be ONC adopted standards yet, but may be standards that have some work among the industry consensus standards bodies like HL7 or SNOMED or others, and to leverage those rather than going off and trying to use proprietary custom bespoke standards. So hopefully that gives a good background and context for for what the team's going to present. Let me now turn it over to the team for the rest of the presentation. And thank you again for your interest.
Great, thank you, Mickey, and good afternoon and welcome again, everyone. We are so excited that you all have joined us. My name is Larry Jessup, and I am a branch chief here in the Office of Policy at the Assistant Secretary for Technology Policy. I am joined by my colleagues from the Assistant Secretary for Financial Resources, Jennifer Johnson and Joanne Battaglia. They will be giving an overview of the HISAR NPRM proposed rule, and I will be providing a brief overview of the HHS Health IT Alignment Policy. Next slide, please. So just a quick background. In 2022, the HHS Secretary instituted a department-wide management policy known as the HHS Health IT Alignment Policy. This policy did a few things. First, it directed ASTP to establish and oversee a consistent HHS approach to the inclusion of health IT requirements in grants, cooperative agreements, contracts, and policy and regulatory actions across all HHS agencies and programs. Second, this policy also directed ASTP to engage with HHS agencies to align and coordinate health IT-related activities in support of our broader HHS health IT and interoperability goals. So there are 4 policy goals that we are addressing. The first is to establish a consistent HHS-wide approach to standard health IT requirements across HHS agencies and programs to, of course, eliminate program and data silos and advance the effectiveness and efficiency of department-wide programs and policies. Policy goal number 2 fully exercises and builds upon existing HHS authorities to promote cross-agency collaboration and better support each agency's mission. Policy goal number 3 reinforces department goals for nationwide interoperability through consistency in funding and all policies that are related to health IT activities. Because awareness of health IT activities across the department is critical for HHS leadership, policy goal number 4 provides secretary level and cross-agency visibility and awareness of significant health IT activities. Next slide. So important to note here that the HHS Health IT Alignment Policy builds on existing authorities under sections 13111 and 13112 of the HITECH Act. 13111 requires agencies, when implementing, acquiring, or upgrading health IT systems that are used for the direct exchange of individually identifiable health information between agencies and with non-federal entities, to utilize, where available, health IT systems and products that meet the standards and implementation specifications adopted by ASTP under Section 3004 of the Public Health Services Act. Section 13112 of the HITECH Act specifies that agencies shall require in contracts or agreements with healthcare providers, health plans, or health insurance issuers that as each provider, plan, or issuer implements, acquires, or upgrades health IT systems, it shall utilize, again where available, health IT systems and products that again meet the standards and implementation specifications adopted under Section 3004 of the Public Health Services Act. Next slide. So our partnership with the ASFR team is important because the proposed rule that Joanne and Jennifer will now speak about is a critical piece to implementing our HHS Health IT Alignment Policy. So with that, I will turn it over to Jennifer Johnson, who's the Executive Director for Acquisition Policy, Legislation, Oversight, and Workforce, and Joanne Battaglia, who is the Director in their Acquisition Policy Division, and they will provide an overview of the HISAR NPRM proposed rule.
All right. Good afternoon, everyone, and thank you. I'm Jennifer Johnson. I am the Executive Director for the Office of Acquisitions here at HHS for Acquisition Policy, Oversight, and Workforce. And I'm going to talk a little bit about what our office does and sort of our purpose here at HHS, what we do. And then I'll turn it over, excuse me, to Joanne to talk a little bit more about the role that I know you all are so interested in hearing more about. So our office is called the Office of Acquisitions. It's under the Assistant Secretary for Financial Resources here at HHS, which is also the CFO. And another name for our office is maybe the Office of the Senior Procurement Executive. And the Senior Procurement Executive is the director for our office and the Deputy Assistant Secretary for Acquisitions here at HHS. So a major responsibility of our office and any SPE office in the federal government is to provide oversight and develop both internal and external facing acquisition policies and guidance that apply to the agency's contracts, in this case HHS. So, and also that support our acquisition workforce. So the folks that negotiate contracts, set the requirements, and all of that, the full life cycle. We are also responsible for developing and establishing external regulatory guidance that apply only to HHS contracts. And we do that via the HHSR, which you see. Also, it's called the HHSR, the HHS Acquisition Regulation, which is a supplement to the federal acquisition regulation. Most large agencies do have supplements that prescribe specific policies and guidance for their contracts that come directly through their agency. So that is one of our primary responsibilities here in the Office of Acquisitions. We do work very closely with our OpDiv and StaffDiv heads of contracting, program offices, and the Office of General Counsel to create those policies. And I know one that we recently issued is the high-tech rule, as we call it. And so Joanne is going to go over that in a little bit more detail. And so Joanne, I will turn it over to you and we can go to the next slide.
Thanks, Jennifer. Now I would discuss specifically the Health and Human Services Acquisition Regulation, also known as the HHSR, Notice of Proposed Rulemaking, Proposed Rule for Implementing Standards for Health Information Technology in HHS contracts and the accomplishments to date. In December of 2022, the HHS Office of Acquisitions issued a HHSR Class Deviation Part 339, Acquisition of Information Technology Standards for Health Information Technology. This class deviation implements requirements to procure health information technology that meets standards and implementation specifications adopted by HHS, consistent with sections 13111 and 13112 of the Health Information Technology Act, also known as HITECH Act. This class deviation added a new HHSR subpart 339.70, Standards for Health Information Technology, which provides definitions, policy, and a prescription for a new HHSR clause to implement requirements of the HITECH Act, to include 1, when contracting officers must procure health IT that complies with the HITECH Act, and 2, when to require use of health IT that complies with the HITECH Act in contracts and agreements with healthcare providers, health plans, or health insurance issuers. The class deviation was issued in advance of this proposed rule to implement in the HHSR the requirement of the HITECH Act and HHS's implementation standards. In January and February of 2023, the Office of Acquisitions obtained regulation identifier numbers RIN 0991 AC 35 for this proposed regulation. And this HHSR case was added to the fall 2022 Unified Agenda. In February of 2023 to May of 2024, the Office of Acquisitions drafted the Notice of Proposed Rulemaking, which underwent multiple rounds of reviews and edits, including HHS agency clearance. Then last month, on August 9th, 2024, the Notice of Proposed Rulemaking was published in the Federal Register. Here is the link to the NPRM, and the public comment period ends on October 8th, 2024. Next slide, please. I would like to give a summary of the HITECH proposed HHSR rule. HHS is proposing to amend the HISAR to implement and align requirements related to the procurement of health IT with standards and implementation specifications adopted by HHS. This proposed rule would add a new HISAR subpart 339.70, Standards for Health Information Technology, which provides definitions, policy, and a prescription for a new HISAR clause to implement requirements of the HITECH Act, to include when contracting officers must procure health IT consistent with requirements in the HITECH Act, and 2, when to require use of health IT in a manner consistent with requirements in the HITECH Act, in contracts and agreements with healthcare providers, health plans, or health insurance issuers. This proposed rule would implement requirements in the HISAR that it will apply to all solicitations and contracts issued by or on behalf of HHS entities that involves implementing, acquiring, or upgrading health IT used for the direct exchange of individually identifiable health information between agencies and with non-federal entities, or are with healthcare providers, health plans, or health insurance issuers that, under contract, would be implementing, acquiring, or upgrading health IT. The clause would provide that by submission of an offer or a quote and execution of a contract, the contractor agrees that they shall utilize health IT that 1, meets standards and implementation specifications adopted in 45 CFR Part 170, Subpart B, if such standards and implementation specifications can support the work performed under the contract. Or 2, is certified under the Health Information Technology Certification Program if certified technology can support the work performed under the contract per certification criteria in 45 CFR Part 170, Subpart C. Additionally, this section would also encourage contractors, if such standards and implementation specifications adopted in 45 CFR Part 170, Subpart B cannot support the work as specified in the contract, to use health IT that meets non-proprietary standards and implementation specifications developed by consensus-based standards development organizations. There are 2 groups that this proposed rule will impact. The first group are HHS contractors performing work under a contract that involves implementing, acquiring, or upgrading health IT procured by or on behalf of HHS entities used for the direct exchange of individually identifiable health information between agencies and with non-federal entities. The second group are HHS contractors who are healthcare providers, health plans, or health insurance issuers, or to perform the contract are establishing an agreement with a healthcare provider, health plan, or health insurance issuer for any work performed under the contract that involves implementing, acquiring, or upgrading health IT. I'm on slide 10 now, thank you. If the HISAR clause is included in the contract, both HHS contractor groups shall utilize health IT that first meets standards and implementation specifications adopted in 45 CFR Part 170, Subpart B, if such standards and implementation specifications can support work performed under the contract, or is certified under the Health Information Technology Certification Program, if certified technology can support work performed under the contract, per certification criteria in 45 CFR Part 170, Subpart C, when the contractor is an eligible professional in an ambulatory setting or a hospital, or implementing, acquiring, or upgrading technology to be used by an eligible professional in an ambulatory setting or a hospital. Both of these groups are eligible under sections 4101, 4102, and 4201 of the HITECH Act. If standards and implementation specifications adopted in 45 CFR Part 170, Subpart B cannot support the work as specified in the contract, the contractor is encouraged to use health IT that meets non-proprietary standards and implementation specifications developed by consensus-based standard development organizations. I would like to highlight that the Office of Information and Regulatory Affairs, OIRA, has examined the economic, interagency, budgetary, legal, and policy implications of this regulatory action, and has determined that this proposed rule is not a significant regulatory action under Executive Order 12866. HHS expects that the overall impact of the proposed rule would benefit small businesses because the HISAR is being updated to provide needed guidance to ensure HHS's contractors properly understand and can propose and provide health IT that meets standards and implementation specifications consistent with sections 13111 and 13112 of the HITECH Act. In summary, this proposed HISAR HITECH rule would implement requirements in the HISAR that would apply to all solicitations and contracts issued by or on behalf of HHS entities that involve implementing, acquiring, or upgrading health IT used for the direct exchange of individually identifiable health information between agencies and non-federal entities, or by healthcare providers, health plans, or health insurance issuers under HHS contracts. And finally, I would like to remind the audience that comments on the proposed HISAR HITECH rule must be received on or before October 8th, 2024, in order to be considered in the formulation of the final rule. Next slide, please. Here is our contact information for Ms. Jennifer Johnson and myself, as well as some resource materials. That concludes our presentation today. Thank you very much for your time.